You're watching WECT News at 6.
Indulge me for one moment. Take a deep breath and now let it out. That simple exercise is difficult for people living with cystic fibrosis. People like Jacob Venditti. Many of them have lived for years, not just with shortness of breath, but also with coughing spells, infections, hospitalizations. They've also lived with knowing that there is no cure for their disease. But thanks to a new medical breakthrough, there is hope.
There were moments where I definitely felt like I didn't want to get out of bed anymore, because what was the point?
Things haven't always been this tough for 26-year-old Jacob Venditti. Even though doctors diagnosed him with cystic fibrosis at birth, he surfed, he skateboarded, he lived life without giving CF much thought.
Yeah, when I was younger, I always had a hard time admitting to myself that I had it and kind of pretend that I didn't have it, but as I got older, everything became a little more tough.
For patients with CF, breathing becomes difficult. A protein in their body does not function properly. They can't get rid of the mucus that builds up in their lungs and on their organs. They're prone to infections, pulmonary problems, and organ failure. A routine test 4 years ago showed Jacob could only use about 30% of his lungs. Surfing, skating, even holding a job got too tough. He did regular therapies to clear his lungs and try to break up the mucus. But complications earlier this year shook his world worse than ever before.
I had pneumonia like twice, and then I had my ankles were swelling up out of nowhere and I couldn't walk around, and that was really scary for me. Yeah, I had these stomach pains that were awful, and I would just go into the emergency room for just random things like that.
During one of those hospital visits, Jacob's doctor told him about Trikafta. She wanted him in a clinical trial. Before that could happen, though, the FDA approved the drug for most CF patients.
What Trikafta does, it's medications, actually 3 medications mixed together that restores the function of that CF protein. Because it's a pill, it gets to all the organs that are involved.
Yeah, within 4 days of taking it, I could walk up the stairs again, without stopping mid-stairs or at the top of the stairs and catching my breath before I came inside. I slept through the whole night, easily, without waking up, coughing, spitting on my floor or something, I just woke up in the morning and I was like, wow.
Similar stories have come in from other patients. They're seeing immediate benefits from taking this breakthrough drug.
I was talking this morning with a patient who just had a baby, and now, while she has a 1-month-old, is going to get access to this medication. And now she can really look forward to a life with her baby. It's just incredible happiness to have that for your patients.
I was about to get on the lung transplant list before this came out. It was to that point where I was going to need supplemental oxygen on a daily basis, and I was going to have to give up on my dreams.
But now?
Now it's changed. It's a miracle, really.
So what are those dreams that Jacob has? Surfing again, the big waves too. And judging by his attitude and Trikafta's success, I think that's going to happen. Right now, Trikafta is available to CF patients who are 12 years and older who have a specific type of gene deficiency. Dr. Donaldson said he's looking forward to when it's available for babies diagnosed with CF and can help keep their lungs working normally without the complications that the disease can bring.